Hello, this is Richard Jacobs with the Finding Genius podcast, now part of the Finding Genius Foundation. Today I have a really great guest, Dale Bredesen. He said his last rhymes with medicine, which I think is pretty cool. He's a professor in the Department of Molecular and Medical Pharmacology at the David Geffen School of Medicine, all part of UCLA. The founder, president, CEO of the Buck Institute for Research on Aging. He's an author, a New York Times bestseller. He's written a number of books on Alzheimer's. So I wanted to talk to him today about Alzheimer's. So Dale, thank you for coming.
Thanks so much for having me, Rich. Appreciate it.
Yeah, how did you get interested in Alzheimer's and why? What's your background with it?
Yeah, actually, I got interested in the brain when I was a freshman at Caltech and read a book that was about the similarities between the computer and the brain. And so I got interested in what actually happens with the brain, how does it work, and then ultimately what goes wrong with it. So this is called Machinery of the Brain by Dean Wooldridge. Fascinating book. And so I went to medical school to learn about diseases of the brain. What I found out was that, in fact, this is the area of greatest biomedical therapeutic failure, as you probably know. As they say, everyone knows a cancer survivor, no one knows an Alzheimer's survivor. So I was very interested in why is it that these neurodegenerative diseases, whether you're talking about Alzheimer's or frontotemporal dementia, Lewy body dementia, PSP, CVD, I mean, on and on, this has been the area where we physicians have failed. And so became a neurologist and started then working when we had nothing to offer these people. Went back to the lab this was now 1989, to see if we could understand the fundamental nature of this problem. So my laboratory group and I spent 30 years going through what actually drives this process at the molecular level with the hope that we could begin, if we could understand it in a basic enough way, we could begin to fashion the first effective treatments. And I think it's been very exciting. We reported the first reversals of cognitive decline in patients with Alzheimer's and pre-Alzheimer's back in 2014. And then, as you said, wrote a book in 2017. It's now out in 35 different languages. And really looking at the first people, what can you actually do? And I think that it's really taught us a lot about not just about Alzheimer's disease, but about medicine as a whole and the difference between 20th century medicine and 21st century medicine.
Yeah, what's funny is probably 18th century, 19th century medicine, and then 21st century medicine are maybe more on the right track because they're considering diet and lifestyle and not just medications. And then 20th century medicine seemed to, kind of get pushed into the drug regime and ignore everything else. So hopefully we're returning to a more holistic overall view of medicine.
Yeah, and we're agnostic. Whatever is going to help make patients better and make us understand what's the problem. As you know, 100 years ago, most of us were dying with simple illnesses. And when I went to medical school, which was way back in the 70s, they taught us to figure out what it is. What's the diagnosis? And then you write a prescription or you send the person to surgery. And now 21st century medicine is not so much about what it is, but about why it is. Why did you get this problem? And virtually all of us today are dying not of these simple illnesses like tuberculosis or diphtheria. We are dying of complex chronic illnesses, Alzheimer's, cancer, other degenerative diseases, cardiovascular disease. These are all complex chronic illnesses. And they have many more components. And when you actually look at what drives the degeneration in the brains of patients with Alzheimer's, what you see is that there are dozens and dozens of different potential contributors. So you have to look at it in a very different way than this old idea of we're going to write a single prescription and it's going to make things better. And as you know, there have been over 400 clinical trials for Alzheimer's drugs that have failed. The best we can do so far is pretty minimal.
Yeah, I interviewed a lady about a year and a half ago, and she, I guess, was doing a meta-analysis of 150 Alzheimer's trials. And I said to her, well, how many of them looked at diet and exercise? She's like, oh, that's too hard to look at. None of them. Yeah. So, I didn't say anything, but in my mind, I was like, oh, there goes more billions to be lost in the future. I think because they refuse to even look at this part of it.
Yeah, that's exactly right. And we just completed a trial, and this is the first trial that flipped the script. So the bottom line, you mentioned, lifestyle and diet and things like that. But the bigger story here is it's about figuring out for each person what's driving the problem. And typically we find 5, 10, 15 different things that are all contributing. And then addressing those with a personalized precision medicine protocol. So instead of predetermining, which is what all the previous trials